Welcome to the Patient Educators Update, a show where we talk about patient education and patient education topics in a clinical environment. My guest today, as always, is Fran London. Fran is a patient education specialist for Phoenix Children's Hospital, and she's also a noted author, most recently author of the book No Time to Teach, which was voted Book of the Year by the American Journal of Nursing in 2010. Hi, Fran.
Hi, Chuck.
How are you?
Great.
Good. Well, I understand the weather's been kind out in Phoenix. You've had a break in the heat?
We had some rain. Very welcomed.
That's good. We had a little bit in Texas, too, although my little town didn't get any, but all around us we did, so that helps the lakes, so that's really good. Well, as I was doing the show prep this week, I was kind of having trouble coming up with some ideas, and so what I did is what I probably should do every week is I took your book and I thumbed through it and I stopped at a page and picked out a topic. And here's where I stopped. And you called the chapter How to Waste Time Teaching. Well, for purposes of our discussion today, I'm going to call it the 8 most common patient education mistakes. And we're going to go through these one at a time and get your feedback on these. You wrote them, so I know you have some thoughts about them, and I know you also live these every day in terms of not only your own process of dealing with patients, but also in the folks that you work with. And I've seen some of these too, so I think we'll have a good discussion. The very first one that you talk about is make assumptions. Why is that a mistake?
That's the biggest mistake that people often make. And it's mostly because it's a conversation stopper. It's a relationship stopper. The best example I have of that is when in a patient education situation and you start talking about birth control. And if you're not aware that the patient is gay, that might be a conversation stopper.
I would say so. Yeah, that's one of those things goes under awkward or irrelevant.
Exactly. And it really hurts the relationship.
Yeah, and how do you avoid making assumptions? What should they do?
Assessment.
There you
Ask
go.
those questions. Yeah.
Yeah, and we did a whole show on assessment. I don't remember the number of it right off the bat, but for those that are watching that want to know more about assessment, they can look in some of the previous shows that we've done. And if I recall correctly, assessment was one of the things that most people skip, but ultimately is the thing that saves the most time. Is that correct?
Exactly. That's why it ended up on this list again.
Okay, excellent. All right. Number 2, teach before you know who you are teaching.
Which also refers to assessment.
Mm-hmm.
And the problem there is you need to know what they know, what they believe, who they are, so that when you present whatever information you present it appropriate for them.
Sure, that makes sense to me. And, a real life example, my wife's been a type 2 diabetic, but she also takes insulin. And she was in the hospital for a shoulder surgery, and the nurse noticed that she was diabetic and started talking to her about her diabetes and care for this, that, and the other, without asking her any questions. And my wife said, well, no, your information's not right. I've been to my endocrinologist. I've got this, I've got that, and this is what I'm supposed to do. And if she had just asked a question,
yeah,
all that time could have been saved. And, kind of after that, my wife just kind of wah. She didn't pay attention to her after that. So I think that's a pretty important one. Now, number 3, this is interesting. Because in the book, you just list it, but there's no explanation. And item number 3 is talk. What do you mean by that one?
Well, there are lots of ways we waste time when we're with patients. And some of it is talking about stuff that's just irrelevant and has nothing to do with that issue at hand.
Yeah. And I would tell you that my wife is a champion at that. She can get a doctor or a nurse off task so easily by just saying, I love your earrings, or where'd you get that bracelet? And there you go. They spent 10 minutes and they've got 10 other patients to go see, and we never got to the topic at hand. So you got to watch out for my wife in that type situation.
And most people, I think part of it is just wanting to build the relationship with the caregiver so that you really can feel like you can trust them.
Yeah, yeah. Number four is lecture. Now, one could look and say lecture and talk, talk, talk are the same, but I don't think so. What do you mean by lecture?
I've had so many doctors do that to me when I was a patient. Just they have some idea in their head that they want to get into your head, and they just lecture about it. Or if they have an opinion that they think you're not doing something right, they'll just give you a stern lecture.
Boy, I've got a great example for that. Back to my wife and her diabetes. We've been through quite a few endocrinologists over the years, and we went to one that he came highly recommended. And so we were excited to go see him, and we took all of her meds that she had and everything. And he started off great by asking a lot of questions and asking about her lifestyle and all this kind of stuff. And then took her big, we had the big Ziploc bag full of medicine. We decided to bring them rather than the list. And he was saying, well, no, you don't need this, you don't need that. This causes this problem. And I was enlightened. I thought this was great. And then he went into a 20-minute diatribe on the evils of Big Pharma.
Yes.
And, and I was stunned by that, and we went to see him two more times after that. And I told my wife, I said, I can't take this. Every time we go, we get a big lecture on the evils of big pharmacy companies. And it's just not appropriate or germane to what we're there for. So we found a different guy after that.
Yeah, I've gotten lectures about the health insurance companies.
Mm-hmm. Oh, yeah. Yeah, it's easy to get in those discussions. Item number 5, don't let the learner interrupt you. Now, I can see that's a horrible mistake, right? They have a question.
Yeah, well, I've seen that happen in lectures, certainly, and definitely within patient education situations.
Mm-hmm.
And the issue is really adult learning theory, is that adults don't learn the same way that children do. Children learn things that you think they need to know in order to grow up to function. Adults, on the other hand, are already functioning. They know how to get through life. They know how to solve problems. The times when they want to learn are usually when they have a problem that they're not solving on their own. So they're ready to learn something new. And if you don't let them ask questions when they have the questions, you're missing an opportunity to actually teach them something, because that's when they're ready to learn.
Yeah, absolutely. And I've often heard that referred to as a teachable moment.
Absolutely.
When the patient is in the willing and ready to learn mode, and that doesn't often happen sometimes, depending on why they're in the hospital. So yeah, when you let those teachable moments or learning opportunities go away, or don't pay attention to them, that's a learning opportunity that is totally wasted, and sometimes those are rare.
And that goes hand in hand with lecture. That if you're
Mm-hmm.
lecturing, then you're not going to stop to let them ask.
Yeah. Item number 6, listen in a hurry. What is that?
Sometimes we go into a patient's room and have an idea of what it is we want to talk about. And if you're always thinking about what the next thing you're going to say is, or where the next topic is going, you're hurrying getting through what it is you want to talk about. And then you're not really listening. When they ask a question or when they say something or make a response of some sort, you're not there. You're someplace else.
Yeah, and sometimes that's the fault of the system too, because there's so much pressure put on the nurse to do this and do that and document this and document that they're thinking ahead of really their next patient, knowing that I've got 10 more things to do before the end of my shift or whatever, and so got to hurry up and get through that.
But that's my point of this list, because if you do these things, if you're aware of these things, you could teach more efficiently and more effectively in the time you have, and you're not wasting so much time. So you may feel like you don't have much time, but there are ways to use your time so much better.
Makes total sense. Number 7, ignore or make light of the learner's concerns. I've never had a doctor make light of anything that either we've said or my wife has said. Ignore is a different thing. But what have you seen there?
I've seen both. I've seen both. One situation where you often see making light of is if a parent is asking about immunizations and is wondering whether or not they should get their child immunized.
Mm-hmm.
Sometimes the healthcare provider is so convinced immunizations are absolutely wonderful and perfect and everyone should have them that they don't actually hear what the concerns are that the parent is bringing up.
Yeah. Yeah, I can see that. We've had some spirited family discussions because we have grandchildren now, and sometimes the spouses that your children marry don't have some of the same views that you do, and so there can become some pretty spirited discussions about that. And I can see how if I was in a situation like that and somebody said, "Oh, well, no, I'm not sure about this," that I could just blow right through that, because it doesn't make any sense to me.
Right.
And so I could see very easily to, the ability to ignore that. And that goes back to assessment and
Always.
knowing who you're talking to, doesn't it? It always goes back to that.
Yeah.
Number 8, teach when the problem isn't a lack of information. What do you mean there?
That happens more often than we realize. I mean, one example for sure is with obesity, which is a big issue coming up now a lot. A lot of people understand nutrition and they understand what they should be eating and not be eating and that they should be exercising more. But the issue is not education. The issue is how do they apply it to their lives.
Yeah. Yeah, I totally agree with that. Now, there was another example that you gave in the book. It wasn't near this chapter. It was farther up in the book. But it was a story about, I think it was a young girl in a wheelchair, and she had problems with skin lesions. Tell us that story, because I think it fits here.
I love that story because it was something that I experienced when I was a staff nurse early on. So I learned early on how important it was to listen to people and to ask questions. Basically, she was a adolescent with spina bifida, and she was readmitted frequently with osteomyelitis, just infections that started with skin lesions that went down to the bone, and she needed antibiotics in the hospital over and over again. And we would keep teaching her about skincare and her parents about skincare, and somehow they just kept coming back. And finally, after one admission, a nurse asked, "Why do you think this is happening? Why do you think they keep coming back?" And the girl knew the answer. She knew what the problem was. Basically, in their small house apartment, her wheelchair did not fit through the doorways. So whenever she got home, she would have to jump off her wheelchair and crawl around the house to get around. So once we realized that, we were able to get home care to get her a smaller wheelchair that did fit through her doorways, and the skin problems stopped.
Isn't that amazing?
So it wasn't education.
Yeah, it wasn't education. In this case, it had everything to do with asking the right question or going farther than the typical questions and looking for environmental issues. That's interesting, but I found that story particularly interesting when I read it the first time in the book. It's like it just goes to show you that it's not all about the medicine. It's all about the relationship and the questions and asking that one more thing when you know whatever you're doing right now is not solving the problem. There's something else that's being missed.
And when there is an issue like that, it really does help to ask the patient, well, what do you think is going on, or what do you think the problem is?
Yeah.
They might have insights that you have no idea about.
Yeah, sure. Makes total sense. Well, this was good. I enjoyed this conversation. We covered the 8 most common patient education mistakes out there. And you can find these in Fran's book, and you can get Fran's book, No Time to Teach, wherever books are sold, at Amazon or Barnes & Noble. It's in both electronic form and paperback. And for hospitals out there, if you want to get some bulk purchases of these, you can get a 40% discount by visiting the publisher, Pritchett & Hull, and their web address is p-h.com. Fran, where can people get in touch with you?
I'm always on Twitter at No Time to Teach, and my website is www.notimetoteach.com.
And you publish a blog there frequently. I encourage people to go visit and make some comments. And then if they also prefer Facebook or Google Plus, you're also on those. And I think I saw you on Pinterest the other day too. Is that correct?
Yeah.
Yeah.
There aren't too many patient education pictures, but when there are, they're fun.
Yeah, I would agree. I've seen you there too. Well, thanks very much for your time today. I look forward to talking to you in the next couple of weeks. I want to let the folks know that the Patient Educators Update is brought to you by Synergy Broadcast Systems. My name is Chuck Jones. I forgot to tell you who I was, but not that that's important. But at Synergy Broadcast Systems, we make the medical media delivery system, which is a video-on-demand based patient education system. So you can provide 24/7 video education materials for your patients at a price that you might be surprised. It's much lower than you think. For more information, you can visit our website at synergybroadcast.com. Thanks, Fran. I'll talk to you soon.
Thanks, Chuck. Bye.